If you've been told there's a mass on your kidney or you've got blood in your urine, your mind, of course, immediately goes to the worst case scenario. So I just want you to take a breath. I know the word cancer can make everything feel frightening and very, very urgent. But with kidney cancer, it's often treatable, and we can treat it with highly precise, minimally invasive surgery, such as robotic surgery. So in this video, I want to talk to you about what kidney cancer is, what to look out for, how we diagnose it, and what treatment options are available for you. So my name is Sotonye Tolofari. I'm a consultant urological surgeon based in Manchester. So let's start with the question that everyone always asks me. Kidney cancer isn't always dramatic. It's often subtle and slow growing. So in terms of the anatomy of the kidney and what the kidney actually does, it should really be considered as a very sophisticated water filtration system. The kidney has a number of different functions, but the primary function is to filter the blood and make urine with all the waste products. Now, in some cases, the cells within your kidney can become abnormal and start to grow abnormally. And this fundamentally is what a cancer is. And in some cases, these cells can grow into a larger group of cells known as a tumour. So there's a few important points to explain here. Not every tumour or growth on your kidney may be cancerous. In many cases, there may be what we call benign, which is a non-cancerous growth on the kidney. The majority of kidney cancers or kidney tumours are found incidentally in this day and age. And what we mean by that is, you may have had a scan for another reason, and actually we've picked up a tumour on the kidney that we weren't expecting to find. The most common type of kidney cancer in adults is called renal cell carcinoma. So one of the biggest risk factors for kidney cancer is obesity. So we know if you've got high BMI, the fat around your kidney predisposes you to developing kidney cancer. Second of all, if you've got high blood pressure that's poorly controlled, can contribute to causing kidney cancer. If you've had a family history of kidney cancer, then we know that can increase your risk. There are certain inherited rare genetic conditions that again can increase your risk of kidney cancer, such as von Hippel-Lindau syndrome. Smoking, as with all cancers, this can increase your risk of developing a cancer. And then finally, as with all cancers, we know that the older you get, unfortunately, the more likely you are to develop a cancer. A common question that I get from patients is, have I caused this? You can never blame yourself for developing a cancer, particularly kidney cancer. We know many patients who have risk factors who develop a kidney cancer, but we know many other patients who have absolutely no risk factors who still develop a risk factor. No pain, just blood in your urine. Kidney cancer can present exactly like that. So one of the challenges with kidney cancer, like many other cancers, is that early forms of kidney cancer cause no symptoms whatsoever. And as I mentioned earlier, we know about 90% of people who present with kidney cancer present incidentally. But when symptoms do happen in relation to kidney cancer, we do need to take them seriously. And some of these symptoms might include blood in the urine, also known as hematuria. We know that about 25% of patients who present with blood in the urine will have a cancer somewhere in their urinary tract. Pain in the side or the flank. Again, this is a rare cause or a rare symptom of kidney cancer, but again, something we should take seriously. And then finally, one of the least common things that people present with is a large lump or the feeling of a mass in their abdomen. This is often a really, really late sign and something we see very rarely in the modern age of medicine. Now let me just pause on the idea of blood in the urine, because this is one of the most important red flag features that we see. Sometimes it might be obvious, so you may have dark red blood when you actually go for a wee, but other times it might be more subtle. It may just be that the urine looks a bit discoloured or even pink, or even just like a rosé wine. All of these are still worrying features, and I would seek medical help on this immediately. The key message here is if you see blood in your urine, even just a single time, and it goes away, it's still just as important, so please seek medical attention. Other symptoms of kidney cancer can be a bit more generalised. Things such as unexplained weight loss, loss of appetite, persistent tiredness or fatigue, a low-grade fever without any clear reason, a general sense of not feeling well or not feeling right. So a simple analogy would be, if the plumbing within your house all of a sudden starts leaking abnormal coloured water, you'd seek help from a plumber. The urinary tract is exactly the same. You may argue that as a urological surgeon that I'm a plumber also. Here's exactly how we diagnose kidney cancer, step by step. So when a patient hears that we need to investigate them for a mass in the kidney, understandably, their anxiety would often go through the roof. But here's the step-by-step process that we usually follow to get to a diagnosis of kidney cancer or not kidney cancer. So first of all, your doctor may ask you about any symptoms it may or may not have had. We'll then move on to do examination of your abdomen and also some blood tests. Initially, blood tests would include kidney function, your full blood count, and a general assessment of your overall fitness. Now, whilst this assessment doesn't diagnose kidney cancer, it gives us a good idea of your overall clinical picture. And with this information, we can then start planning potential treatment options for you. So imaging really is the cornerstone to the actual diagnosis. It may be that you've been found to have a kidney mass on an ultrasound scan, for example. Now, we know that ultrasound scans aren't particularly accurate at detecting masses in the kidneys, so usually when you come to see a urologist, we would recommend a CT scan. In some cases where there is some diagnostic uncertainty, it may be we'll arrange for you to have an MRI scan instead that may help give us some additional information. And the final investigation we really discuss is a biopsy of a renal tumour. And quite a common question that I get asked is, do I need a biopsy? The answer to that is sometimes, but not always. In many cases, particularly if you've got a large tumour, the CT scan can always be diagnostic of a cancer in the kidney, in which case a biopsy isn't really appropriate and we just rush you straight to surgery. Not every kidney cancer is a race to the operating theatre, and that can surprise a lot of people. What I explain to my patients is that the treatment options available depend on a number of different factors, and those factors might include the size of the tumour, the position of the tumour within the kidney, how suspicious the tumour actually looks on imaging, what the individual patient factors are, such as age and other medical conditions, how well the kidney actually functions overall, and then finally, whether the tumour appears to be localised or whether the tumour has spread. Now, if you have a very small mass on your kidney, and by that I mean a mass that is less than 3 centimetres, we know that these masses on the kidney are perfectly safe for us to observe with surveillance. The reason I say that is because when we look at the most recent literature, we know that the risk of these cancers spreading or causing significant harm is less than about 1%. And we know that these tumours grow by about 2 millimetres a year, so we can safely observe them for a period of time. So active surveillance doesn't mean that we are ignoring the tumour. What it means is that we are monitoring it carefully with repeat and regular imaging. We're carefully observing its growth rate. And then if at any time that pattern of behaviour or that pattern of growth changes, we can step in with surgery or other potential options. Now, for other patients, treatment is clearly the right next step, especially if the tumour is larger, we know is actively growing, or appears to be aggressive in some way. Kidney cancer treatment doesn't always mean big surgery. Here's the minimally invasive approach. Kidney cancer doesn't always mean a long hospital stay anymore. This is a part that many patients are often relieved to hear about. If we perform minimally invasive surgery, it means that patients recover quickly from surgery, and also they don't have to have any major or large incisions that can sometimes keep them in hospital for a week or so, meaning they've got a long recovery time. This also helps avoid the risks traditionally associated with major abdominal surgery. Common minimally invasive approaches now include laparoscopic surgery, robotic surgery, and in selected cases, ablative treatments such as cryotherapy or radiofrequency ablation. So let me explain these simply. With minimally invasive surgery, instead of one large incision, we do a series of small incisions, usually about 1 centimetre in size, at the front or the back of the abdomen to allow us to enter into the abdomen to then find the kidney and then subsequently remove it. Meaning you have smaller incisions, less pain after surgery, quicker recovery times, shorter hospital stay, and early return to your normal activities, which may be within 4 to 6 weeks. Okay, so now to look at some different types of kidney surgery. So the first of which would be what we call a partial nephrectomy. Now this essentially is removal of part of the kidney rather than the entirety of the kidney. And we use this primarily for patients who have got what we call a small kidney mass. So you can remove the bad area from the apple, but you can still maintain the apple to eat it later. So the next is radical nephrectomy. So this is actually removing the entire kidney. Now this can again be done via a minimally invasive approach, which is either robotically or laparoscopically, both keyhole techniques. It can also be done by a more old-fashioned approach, which is a big open incision dependent on the size of the kidney. So in some selected cases, for small tumours, for example, a 3 or 4 centimetre tumour within the kidney, we consider what the individual patient factors are. So if you are a patient that has a lot of medical problems, or you've had a lot of previous surgery, it may be that surgery may be very, very high risk for you. In which case, we may be able to offer something like an ablative treatment. And this is actually where we perform a procedure to destroy the cancer cells or destroy the tumour, but you can avoid the risks of surgery. What does life look like after kidney cancer? Let's talk about it. So after diagnosis and treatment discussions, the next question is often, well, what happens next? So let's break that up into 3 parts: recovery, follow-up, and overall prognosis. Recovery depends on the type of treatment you've had. If you've had minimally invasive robotic surgery, you can be expected to be in hospital usually overnight or perhaps a couple of days at an absolute maximum, provided the surgery's gone well. You'll have a gradual improvement in your mobility, usually over the course of a couple of weeks. I often say to patients, you walk into hospital, you walk out of the hospital, you'll just be walking a little bit slower. You can get a step-by-step return to your activities of daily living, usually over the course of about 4 weeks or so. Now, if you've had more traditional major open surgery with a big incision, in that case, you'd usually be in hospital for about a week or so. And your recovery is usually a bit prolonged because you've obviously had a large incision. And it may take 6 to 8 weeks or even longer for you to get back to your activities of daily living. Okay, so follow up. So after treatment, if you have had a diagnosis of kidney cancer, it all depends on your kidney cancer risk. Now, we split kidney cancer into low, intermediate, or high risk. If you've had low risk kidney cancer, we usually follow it with regular CT scans and blood tests for 5 years. If you've had intermediate or high risk kidney cancer, we usually follow up with blood tests and regular scans for up to 10 years. Prognosis. So this is the part that people are often most scared about. Am I going to be okay? The answer to this is the majority of patients who have kidney cancer, particularly low risk kidney cancer, do very, very well. Overall survival is very, very high, and the risk of recurrence is very low. But overall, your prognosis depends on a number of factors. First of all, the stage of your tumour, the grade of your tumour, and the risk classification of your tumour as well. There are also some particular tumours that are more aggressive than others, so your tumour subtype is also quite important. And then finally, your overall health. So if there's one key message I want you to take away from this video, it's that kidney cancer can be silent, but is entirely treatable. And modern diagnosis and minimally invasive treatment has entirely transformed the way we treat kidney cancer. If you notice blood in your urine, or you've been told you have a kidney mass or abnormality, please go and seek help from one of your local doctors or a local urologist as soon as possible. Getting the right assessment can make all the difference, and as always, as I always say, early diagnosis is hugely important. So if you found this video useful, please subscribe for more clear, reassuring health advice like this. If you'd like to discuss your symptoms, scan results, or just book in for a consultation if you're local to the area of Manchester or beyond, please click into the link in the bio.